That's all the Spanish I know. I'm so sorry. Good morning. Here on behalf of Flora Growth, my name is Dr. Annabelle Manalo Morgan. I go by Dr. Annabelle. I am a cell and developmental biologist with a background in neuroscience. I'm a PhD out of Vanderbilt University in Nashville, Tennessee, and I'm very happy to be in Colombia. I'm very happy to share with you some scientific and medical advancements that are in our plans as Flora that I have been working on for a very long time now, about 5 years, and I finally found a home in Colombia with a group named Flora Growth that has really embraced me as family and has understood my mission and is going to work with me towards that because it takes a team, and this team is phenomenal. So thank you guys ahead of time for being family, and thank you for the arepas this morning and the amazing food and environment, and I just love you all as people. It's such a beautiful place. So, of course, I have a story. I was working on the largest chemotherapy grant in the world in Nashville. I was doing stem cell protocols. Cannabis was not something that I ever saw myself working in. I have 5 children, and my oldest is 12, and my youngest is 11 months old, 1 girl, 4 boys. And my 3rd child, his name is Macario, he was born with a stroke, and he was born having uncontrollable seizures. So we rushed to the hospital, and they don't know what's happening, but seizures in a baby are very dangerous because this is right when they come out of the womb. They are developing very quickly at this time, and so of course we feared that he wouldn't survive. So they moved very quickly. We were in ICU. They tried every drug regimen on the planet. I, of course, being a scientist, was calling all of my friends and asking them, what can we do for my son? The protocols in modern medicine are very traditional, and we did all of them. However, at 5 weeks old, they did a surgery that's never been done before, where they removed 40% of my son's brain. So, under 2 months old, they decided to remove his left occipital lobe, which you can see here, and the left temporal lobe. So those areas are missing currently in my son. And if you think about those areas of the brain, if you don't understand science of the brain, those areas are responsible for processing, for memory, for verbal speech, for motor control. I mean, literally, what is this kid going to be able to do missing this much of his brain? The other areas of his brain, sure, are there for emotion, movement, and some verbal recognition, but all of his left brain was basically missing. Left controls right, so we were told that my son would never use his right side of the body, he would never eat on his own, he would never talk on his own, he would never play like a normal child. So, of course, a journey started for me. I was still working. I finished a chemotherapy grant where we studied cardio-oncology and chemotherapies and the effects of those chemotherapies on heart disease. But in the back of my mind, all I can think about was, what can I do for my son to replace all of these medications he's on? So he turns 6 months old, and he's no different than a newborn baby. At 6 months old, he cannot look at you around the room, he cannot laugh with you, he's not crawling. And for those of you that are parents, at 6 months old, that's a milestone. Your baby's sitting up, and your baby's starting to eat rice cereal and porridge, not just milk, and my son was no different than a newborn baby. So I felt that God made me a scientist for a reason. And I knew I had to do something. I had nothing to lose. So I started studying, and of course, I'm not on Google and looking at Instagram for how to help my son, right? I have access to papers, but not just research papers that have been published. I have access to research papers on what has not been published and maybe what has gone wrong and what other scientists, like myself, have utilized. And so I continued that search, and I first searched all of the 7 medications my son was on, and I realized these drugs are just like a Band-Aid on the brain. They're not going to heal him. They're not going to allow him to develop over time. They're just there to stop seizures, to make us comfortable for the time being. And after doctor visit, after test, I began to study. And I studied harder than I've ever studied in my whole life to try to find something that I can give to my son. And I went to the lab late hours. This is a true story. I went to the lab between 1 a.m. and 4 a.m. for a month when my son was 6 months old, and I created him a medicine. And I took that medicine, I didn't tell anybody but my husband, and I went home and I just started giving the medicine through his G-tube that he used to eat. And in 2 days, my son's eyes started to move around and he can look at us throughout the room. So at this point, he's 7 months old. In 2 months, he started crawling. And the most phenomenal thing about him crawling is, remember, he's supposed to be paralyzed on the right side. He was using left and right like it was nothing. At 14 months old, my son was walking, and then everything just started advancing like he was playing catch up in life. Macario is 5 years old today. He just started kindergarten. He's no different than any other kid. He walks, he plays, he runs. He's still missing 40% of his brain, and he's no different. He has no developmental deficits, and that is Macario. So that's an incredible story, right? But how did that happen? How do we do that again? How do we help another sick person like my son go through a miracle like this? So my focus was neuroplasticity, and I'm going to teach you some stuff today, and I'm sorry because I don't know what neuroplasticity means in Spanish, but we need a translator. We need to say this properly because these people need to know this word. Neuroplasticity is the focus of cannabinoids. Neuroplasticity is the reason why cannabinoids work within our body. It is a focus of the central nervous system. And when things go wrong, neuroplasticity adapts to that change and enables us to be able to move forward. So think of neuroplasticity as a shortage in electricity, and then cells talk to each other. I know you don't know what cells look like, but just bear with me. And then we get this electricity because we are essentially electricity. This electricity comes back to life, and that's what neuroplasticity is. It's the ability to adapt to change. When you see people get sick and they get better, neuroplasticity was involved. When you get injured and you get better, neuroplasticity is involved. When you have a headache and you feel better, neuroplasticity is involved. And who are the drivers of neuroplasticity? They're neurons. Neurons are cells. They're all throughout our body. There are over 100 billion neurons by the time you're an adult. The brain stops developing at 22 years old. And guess what? Each one of those neurons can create 15,000 connections. That's trillions of connections. What does that mean? It means when you're walking and you see a puddle and you want to jump over it, you're activating thousands of connections for your brain to tell your body to jump over that puddle, right? And all of that leads to compartmentalization of the brain. Every area of the brain is responsible for something. But the cool thing about neuroplasticity is sometimes we can have crossover between these layers. These are just a few, this is just a beautiful picture. The brain is very much more complex than this. But for instance, sometimes if something goes wrong here, then these areas can respond and help areas there. And the reason why it's so important is because when I found cannabis, I realized that the endocannabinoid system fuels all of that functionality. All of that can work by giving somebody cannabis. But how? I just told you that there are trillions of connections, and all of these connections have different roles. So how do we define that? If you want a particular connection to work, don't I need a particular type of cannabis? Those are areas that we feel need to be filled. These are areas that are gaps in the cannabis industry. In the last 5 years, since this all has happened with my son, since this search in the cannabis research has started, I've seen companies grow all over the world. I worked in Israel, I worked in Korea, I worked all over the world, just collaborating with different scientists and really want to give to this industry and find out what everyone else is doing, right? So my focus is the medical side. What are we giving people? What are we making people? And I see cultivation is just booming, and processing, amazing, and delivery. The technology is incredible. But the scientific research that actually allows us to give the name medical cannabis, that scientific research is really no different than it was 5 years ago when I started searching for my son. And I think that's a problem. I think that that is the gap that we all need to fill. And I think that that's where we have to really cross over that hump and where we can start having the conversations with INVIMA and FDA about how we can get doctors and scientists to start trusting the plant. Because if you think about the plant now, we talk about CBD. Incredible compound, just phenomenal. CBD allows for homeostasis. It indirectly binds to these receptors. So it doesn't only cause binding in the endocannabinoid system, but it just causes a full-out homeostatic balance. It's intriguing. It's actually giving to our entire being, to every system, our vascular system, our cardiac system. It's more than just the endocannabinoid system. THC, most popular psychoactive on the planet. Not the only psychoactive, but the most popular psychoactive on the planet. And what do we know about it? Not as much as we think we do, not scientifically. And not enough for me to go to my colleagues and say, hey, this is the reason why this worked for my son. It's not just a miracle. This is the reason. And a lot of you know about the synergistic effect if you've been in this industry, and we love it, and we believe that using more of the plant is more beneficial, and I believe that too. But how do we necessarily agree to that when we don't know what all of these isolated compounds do on their own? So I'm giving you kind of like a really traditional understanding of how we go through compounds in science to make medicine. Don't get it twisted, the recreational and the wellness space, amazing, wonderful. But when we start up talking about medicine, we have to do some due diligence, right? So here you have a list of a bunch of cannabinoids. These aren't even an eighth of the cannabinoids that exist within cannabis. There's so many. And all of them create other cannabinoids, depending on what you do to them. And all of them have their own mechanistic functions, right? Let's break down that list and highlight cannabinoids that are actively being studied. THC, CBD, CBG, CBC, CBN. Not really actively being studied, but actively being used. You know, we have stories, and we have so many anecdotal stories, and I bet more than half of this room, you have a reason for being in the cannabis industry. But how do we convince everybody else so that we can do what we want to do with this plant? Well, first is 90% of the pharmaceutical drugs that are on the market today are plant-derived. All of these drugs come from compounds in the plant. But we understand those compounds scientifically. We know the side effects. We know what not to use them with. And then they synthesize them so they can make more, and it's a market, and that's okay, but you can't fight something that you don't understand, right? So how do we look at every molecular component of cannabis so that we'll be stronger in our stance and come together and create a protocol? And going back to what I was doing with my son, hours and hours of testing in a little dish to just create one small thing. And you're gonna ask me, so what were you creating it for? Was it for epilepsy? What disease was it for? Was it for, I don't know, brain loss? I created that not because it could stop seizures, not because it would heal the area that's missing, not because it would compensate for the area that he lost, but because of all of the above. So there's 3 functions that one cannabis product can do, and that's the beauty of cannabis. It's diverse. And it's not always about what cannabinoid, it's how. How are you delivering it? What are you putting in it? I wanted to make sure that the drug I made for my son had no drug interactions, it could cross the blood-brain barrier, and that it could replace the function of 7 medications. That was my goal. And I did that in less than a month. And if we start thinking that way, then the science that we do on a day-to-day basis can get out of the box and start becoming a part of everyday medicine. But until we do that due diligence, we're kind of standing from afar saying, hey, you need to legalize cannabis for medical use. And then you send somebody to a dispensary and they have no idea what to take. It's all by chance. So I'm very excited to present Flora's scientific initiatives. And I'm going to read you our medical mission. And it's to differentiate Flora growth as the leader in global cannabinoid research and the creators of pharma-grade products backed by science. That's powerful. It's a really big mission. It's not going to happen overnight. You saw Luis yesterday talk about the different divisions that we have within the company that focus on different areas that cannabis lends to. Science is a whole nother beast. The pharma side has to have its own divisions. And we're doing it. So how the scientific initiatives will achieve this medical mission? We're going to use traditional NIH and FDA protocols. These initiatives will focus on applying every aspect of taking a new drug to market or an NDA. So we'll use traditional ways. That's what you guys want to see? We'll do it. We'll do the science. In parallel, we can run studies that will be generalized and assist backing of numerous claims. So we're not just doing this for Flora. We're doing this for the industry, and we're doing this for the world. So that you can look at our science and say, wow, they proved that CBG can take this pimple away. And you can go make your own stuff with CBG. That's what we want to do. And we're going to do it by a cell molecular model, an in vivo 3D model, and clinical trials in humans and pilot studies, and check all the boxes that the FDA would love to see. And coming back to this model, we want to know how every isolated cannabinoid works, what their mechanisms are, and what happens when we put them together. That's called foundational research. And we'll take the science that has been done, and we'll support that research, and piggyback onto that research so that we can do more with it and make it a little louder. So if you look at the traditional route, and this part's kind of boring, so I'm just going to slide on through it. There are usually 4 phases. There's phases within phases, which I told my friend yesterday. But what we're not doing in the cannabis industry is we're just not focusing on the basic side. Companies are running pilot studies and observational studies, right? That's, more here. But are they collecting the data appropriately? Can we present that in a scientific conference? We could present it here, but can we present it to a minister of health? And so we'd like to take this approach, but when I say fast track, the awesome thing about cannabis is that it's safe. So I can run a safety and efficacy study all at the same time. I can have 20 patients over here taking cannabis. With that same cannabis, I can be in my lab looking at how they interact with different cells of different diseases. I can be in St. Kitts and Nevis, where I really have green monkeys that we do neurological studies on. We could do that all at the same time. So a 20-year process can take 1 year to present to the FDA in a traditional drug process. But what I'd like to say is, don't think of this as just creating medicine, right? This is just the due diligence work that needs to be done. Think of this as research that we can utilize to present better quality wellness products, more functional recreational products. I mean, it's just knowledge. If we get this data, we'll have the knowledge to really be more powerful in all divisions, in all areas. And there is science that is being done, and I have highlighted a few studies here, and they're great. But what is the plan? If you tell me it works in mice, I need to see like 10 more data sets before we have a true understanding of how definitive that process is. So I talk about discovery, and a group from Yale and we have unpublished research that I'll publish through Flora on the use of medical cannabis and cannabis-derived products in the scientific literature. It's called the metadata analysis, where you literally take every piece of literature that's ever been published or registered in the scientific database, and you create a funnel. And that funnel has everything: randomized clinical trials, systematic reviews, case studies, everything you can imagine that has to do with cannabinoids, terpenoids, cannabis in general. And the report says the overwhelming majority of medical cannabis, cannabis-derived products, which are commercially available, do not currently publish on data to support their marketing claims. We have products out there that are telling people that this cures anxiety. How do they know that? Because it's worked on 20 people? I mean, I kind of buy that. But then the consumer is buying 10, 20 products before they find what really helps them with anxiety, because every person is different, right? So we did this study, it took a year. Our areas of interest were very vague. We looked at fibromyalgia, multiple sclerosis, cancer, epilepsy, you name it. And our goal was to look at all the studies, so a little under 7,000 studies. We wanted to remove duplicate studies. We did an abstract screening, and we only ended up with 66 studies that were validated in a scientific metadata analysis. Again, traditional. Use the traditional ways to really compel what you're doing in the medical cannabis industry. And here are some you guys know: Sativex, Marinol, Nabilone. Tikkun Olam had 6 studies. And all of these studies, Alexinol, Epidiolex, all of these studies were pretty good. They did what they had to do to get FDA approved. But we learned that the focus is on patents Everybody wants to just own everything and stand alone in the industry. It's not, I mean, we all have to work together. That's not really the way to go. You don't have to own everything. There's plenty of room for all of us to win. There's over 500 cannabinoids. And there's over 500 things you can do with this plant, right? So if you want to be selfish, go do something else. Companies are publishing to simply make claims, so the value of these scientific studies are not very good. Synthetics are a majority of the peer-reviewed journals. 3/4 of the studies have limitations: poor design, enrolling very few participants, again, just trying to get the papers out. And there are very few studies on natural cannabis. Here in Colombia, and definitely us as Flora, you know, it's a big goal of ours to utilize the amazing ability to grow natural cannabis at a very low price. So that's definitely something that we want to keep intact. So how do we connect it all? How do you take everything I said and actually implement it? Well, we do the cell studies. I did this study on cells that I put in a dish, and these are cells that are very young. This is tissue. This is very young cell, and I treated it with cannabis, and this is a cardiomyocyte. It's a heart cell, and I was able to make it beat in a dish. And that was a combination of CBD and THC. Very cool, right? And there are other technologies that we can look at. I'm going to go by this for the interest of time. But what now? We are going to progress in parallel. And what that means is, just like that chart I showed you earlier, where you have phase 1 through phase 4, we are going to take advantage of every part of this diagram and run it at the same time at a very low cost. So we're going to focus on fibromyalgia. And we're going to do everything the right way. We're going to get real scientific collaborators. We're going to do it at real universities. We're going to get proper certifications. We're going to run CGMP facility trials. And we're going to do this and try to achieve person studies, neurological disorders. We're going to look at that right away, looking at some animal studies. We're going to look at brain health and recruit people with brain damage, brain tumors, pro athletes, veterans, big space there. And all the while study cannabinoid mechanisms. This will take a good 5 years to do. Look at genetic markers and genetic predispositions. What makes all of these different strains different? What makes all of the different cannabinoid compositions that these plants have advantageous to which disease? Period. Specific formulations for specific conditions per specific person. Because if I get lung disease and he gets lung disease, we shouldn't get the same treatment. We're two different people, right? So it's understanding that and understanding the diversity of cannabis, and that we can take advantage of that in this industry if we do it right. So Flora's medical and wellness products will eventually embody proprietary product formulation backed by science and existing data. I've traveled the world. I've met presidents. This is former president of Ghana. I healed him of Parkinson's disease using a cannabinoid formulation. Ministers in Israel, biggest autism conference in London, in the UK. And I take research that's being done from other scientists and I collaborate. Because there's a lot of work to be done in this industry and it can't be done alone. Thank you, and if you have any questions, please feel free to email me, email the team, Flora Growth, and I'm just so thankful to be here. Thank you very much. Stay there.